Progress.
Hello, everyone, and welcome to this installation of the Lion's Den. I'm your facilitator, Dr. Ashanti Carter, and I serve as the Director of Community College Partnerships at the illustrious Charles R. Drew University of Medicine and Science. Boy, oh boy, do we have a treat for you today. I'm joined by our esteemed faculty, Dr. Parissa Moradi, who will talk to us about cervical cancer and the importance of screening, the importance of prevention, and treatment. So, without further ado, I'm going to toss it over to Dr. Maradi. How are you doing today?
Good. How are you?
Good, thank you. So, thank you for coming into the Lion's Den. So, I want to talk to you about your journey. I'm sure we probably have some students who are online who are thinking, wow, she's a physician. I want to be a physician. So, tell us, Dr. Maradi, introduce yourself first. Tell us about you.
So I'm Dr. Parissa Moradi. I graduated from Charles Drew University. I did my OBGYN residency at Charles Drew, yes. And now I'm a board certified OBGYN and a fellow of the American Board of OBGYN.
Wow. So two esteemed mighty lions in the house. So
Yes.
yes, I'm also an alum of CDU. Wow, Dr.
Oh,
Maradi. Wow, we are just so blessed to have you here. So
thank you.
what made you pursue a career in medicine?
Well, I just wanted to make sure that whatever I do serve the community. So I thought that that's the best thing, and that's the best reward is to be able to serve others. So
Yeah, and that's the mission at Charles R. Drew University of Medicine and Science. It is to serve folks from lower resource communities and also to inspire and cultivate the next generation of healthcare providers. So it's great that you are in that pathway and
yeah.
hey, you're here serving. So since you are a Drew alum, I'm going to put you on the spot a little bit. What was medical school like for you?
Oh, I loved it. Medical school has always been the best part of my life. But the friends that I made there, the memories, everything was the best part of my life. So definitely, medical school was uh, full of great memories.
Some awesome. So, with you being a board certified obstetrician and gynecologist, for those of our scholars, we're like, she said OBGYN, what's that? So, what's the best part of being an obstetrician and gynecologist?
So I think the best part of being a obstetrician is to deal with pregnant patients, which I love. So not only it's the woman, but also the babies been who's not even born yet. So that's the best part of being part of being an OBGYN. Also, being able to serve women with any kind of problem they may have. So that's
Yeah,
the best part
yeah,
of it.
absolutely. And of course, with, women's reproductive health, that is something that's in the news right now. Your work, along with just health policy, that is at the forefront. So for those of you in the audience, please, please, please pay close attention to what Dr. Maradi is going to talk about, because if there's a woman in your life that you love, this is a conversation that you need to hear. So let's jump into it. So I am not a physician. I am in public health. And I just want to so help me out because I'm a layperson, right? So when we think of cervical cancers, they're named. So let me just remember my biology. So they're named after the type of cell where the cancer started. So what are the main two types?
So we can have squamous cell cancer. We can have adenocarcinoma of the cervix. So there are different type of cervical cancer, but mostly the main part that we're going to talk today is the prevention of cervical cancer
And you said it was the squamous.
and adenocarcinoma.
Adenocarcinoma. So what does that mean? Adenocarcinoma.
Yeah, so there are two different cells, and depending on which one will become cancer, so we have two different kind of cervical cancer.
Okay. Okay. So adenocarc. Where is so? Because I'm trying to think of my medical terminology. Adeno means something.
Okay, so do you want to go on the PowerPoint? If we want to start with the
Yeah,
PowerPoint, we
let's do
can
a
just,
PowerPoint. Yes, this should be
yes.
fun. All right, I'm gonna share my screen, you guys, so we can just get it together. So let me go ahead and let me move this.
Oh, good.
Okay, we're gonna
I,
start from the beginning.
yes,
Can you see it?
yes, I can see very well.
Okay, all right, so let's go forward. Okay, tell me when you want
All
me
right.
to stop.
All right. So I just wanted to make sure that during this short amount of time, we make sure that we understand who needs to be screened and how do we screen? What is HPV virus? How do we test it? Who needs to be screened? What's the HPV vaccine? And basically to know the base of the cervical cancer screening, if that's okay.
Mhm.
And so let's go to the next slide.
Okay.
All right. So as you see, when we do a pap smear, we just get one layer of the cells, which usually are the normal cells. But if
Mhm.
the cells become atypical, they start to look different. So the way they will look different is that usually the nucleus of the cells is the first one who becomes abnormal. So we will have some atypical cell. It doesn't mean we have cervical cancer. It just means that um, the cells become a little bit different. Um, let's go to the next one.
Okay.
All right. So who can develop cervical cancer? Anyone, any woman can have cervical cancer. Some women are at higher risk of developing cervical cancer. And who are those? Women who get infected with HPV virus, women who start having sex in a very early age,
Oh,
um,
wow.
women who do have multiple partner or their partner had multiple partners, and cigarette smoking or marijuana smoking, any kind of smoking cause cervical cancer.
Oh, okay.
All
Okay.
right. Mm, okay, next slide. Okay, and unfortunately, what we see is that in Black women, we have 30% more chance of seeing any kind of cervical cancer. And unfortunately, when they are diagnosed with cervical cancer, we see more than 60% of them to die from cervical cancer, unfortunately, compared to the white population. So that's why at our facility, we make sure that all Black women and Hispanic get, all our patients get tested for pap smear, but especially when they walk in, we want to make sure all of them get um, their screening pap smear. And next one.
Mhm.
All right. So who's getting screened for cervical cancer? Any woman who's 21 and older has to be tested for pap smear. Doesn't matter if you are sexually active at 21 or not, doesn't matter. As long as you reach 21, you get tested for pap smear. And then between 21 to 29 years old, you get tested every 3 years. After the age of 30, you can continue being tested every 3 years for pap smear or add the HPV testing, which we call it co-testing, meaning they also test for the HPV virus, which is a risk factor for cervical cancer. And then you can do it every 5 years if it's get tested with HPV.
Okay.
All right, next slide. Okay. So why do we need to get tested for pap smear. Basically, there is no other way to find out if you have a typical cell. There is no change. There is no difference in your vaginal discharge, your menstrual period. So the only way to find out if you have any atypical cell or abnormal pap smear is to basically do the pap smear. And also, if you want to be tested for HPV, which is one of the main risk factors for cancer, we can do it at the time of pap smear. All right, so next slide. So again, just wanted to let you know that we start at the age of 21 and we stop at the age of 65 now. So whoever had pap smear regularly, they can stop at the age of 65 if they had normal pap smear before. Patients who had a hysterectomy, meaning they removed the uterus, usually do not need any more pap smear if they remove the cervix also. The only time they will need a pap smear is when the cervix is still there or partial hysterectomy.
That makes sense.
And right. So what the pap smear does, it just looks for abnormal cells. And if we do the HPV testing combined with the pap smear, it's called co-testing, and it just increases the interval of the pap smear. It goes from 3 years to 5 years.
Wow.
Okay, next.
Yes. Give us our anatomy lesson, Dr.
Yes,
Moradi.
the anatomy. So at the end of the vaginal canal, we have the cervix. And to be able to see the cervix, we have to put an instrument, which is usually a plastic. It can also be a metal. It's called speculum. So it opens the vaginal canal so we can see the end of it, which the cervix, exactly, where the cervix is. And that's where we do the pap smear. We just use like a brush, like we call it cyto brush, and we just we turn the brush like 3 to 4 times, and that's called the pap smear. And after the cervix, of course, we go up the canal and we get to the uterine cavity, which is the uterus. And if we go up from the uterine cavity, we get to the fallopian tube, and from the fallopian tube, we get to the ovaries.
Okay. Got it.
Yeah.
Next slide.
Yes.
Okay. Ah, so this is what happens during that
Right. So
time.
exactly. So that's a speculum just to open the vaginal canal. We can see the end of it. And like you see, we have the cervix, a brush who will just take one layer of the cells. Mhm.
HPV.
And we can test the HPV with the same brush.
Okay. Okay. So maybe we
All
can
right.
pause right here, or you want me to
Mm-hmm.
keep going?
So I was thinking about talking about HPV virus, what it is, and why we need to get vaccinated.
Okay.
So it's a sexually basically transmitted virus. Whoever is sexually active will get the HPV virus because it's such a common virus. And the HPV usually will go away on its own. You don't have to do anything to basically treat the HPV, but sometimes some type of HPV will cause cervical cancer because they will not go away. After 10 to 15 years, the HPV will still be present and they will cause cervical cancer.
Wow.
And
Okay.
we can that's why we get the vaccine before becoming sexually active. When you are very young, you get the vaccine, usually at the age of 9, but you can also get it around age 11 to 12 to make sure before you become exposed to HPV, you are vaccinated.
Got it. Got it. Okay.
And so what HPV virus does, it causes cancer. It can cause mm, head and neck cancer, throat cancer, vaginal, vulva, cervical, penis, any kind of cancer. Yeah, it can cause. So not only girls are supposed to be vaccinated, but also boys are supposed to be vaccinated because it prevents um, penis cancer.
Wow. Wow. And the vaccine?
And the vaccine, usually the pediatrician starts at the age of 9, but 11, 12 is the time we start vaccinating the kids. And it's usually a set of 2. So they get 2 doses of vaccine. If they pass the age and they reach their 15th birthday, then they have to get 3 doses of vaccine. So they get 1 dose, they come back 2 months later, they get the second dose, and then 4 months later, after the second dose, they get the third vaccine. So anyone who's older than 15 has to get 3 vaccines.
Oh,
And
wow.
you can get vaccinated. It usually goes to age 26, but we also in our clinic vaccinate women all the way to age 45.
Oh, wow. Wow, that's great.
Yes. So usually they like to vaccinate before age 26, and they think that after that, since they have been exposed to HPV, it will not work as well, but we do vaccinate our patient up to age 45. And it truly do work. They have seen a huge drop of cervical cancer,
Mhm.
genital warts, and basically any kind of abnormal cells. Since 2006, the vaccine have been started in the US, and we see like 88% drop in genital wart and cervical cancer in young teens.
Wow, that's
So
amazing.
it
That's great.
truly works. Yes, it's a great
Yes.
vaccine.
Yes.
All right, next one.
Mhm.
Okay, and so it's just said the same thing. Like I said, we stop at the age of 65 for the pap smear, and usually patients who had a hysterectomy and had their cervix removed, we don't have to do any more pap smear unless they had cervical abnormal cells or abnormal pap smear before, and that would be different. They have to still come for pap smear, but those are rare cases. Um, so what will happen when you get a pap smear? So usually a few weeks later, your doctor is supposed to call you and let you know what was the result. And hopefully your result is normal, so you're good for another 3 years. If you have done the HPV co-testing, you go for another 5 years. But if there is abnormal cells, that doesn't mean you have cancer. So I usually try to explain to the patient that doesn't mean you have cancer. It just means you need to come back for more testing, which is usually depending on the degree of abnormal cells. It's to do a cervical biopsy.
Okay. Yeah,
Okay,
why
next
don't some
one.
of us get screened?
Yeah. So why some of us don't get screened? That's what we usually hear. We don't like to go to GYN because we don't like to get undressed. It hurts. Um, my mom or my partner said that at my age I don't have to be tested, or some patients said I don't have time to come. I can't keep my kids away. I need babysitter to come to my appointment. And some people are just afraid of any kind of cancer, so they don't want to deal with the idea of screening for cancer. They don't have transportation, they don't have the money to pay. Just opening something here that I think I should say about pap smear. Our clinic, which I work at MLK, which is just across the street from CDU campus. We do have a free clinic. So whoever don't have any kind of insurance, they can come and they can get screened for pap smear and a mammogram for free. So they just give us their name and a phone number, and that's all we need. So nobody should not come to the clinic and saying, I don't have an insurance, I won't get a pap smear, I can't afford a pap smear. It's completely free. On Saturdays, we do have clinic that is completely free, and they just come in and we do the mammogram and the pap smear.
Wow, I want to pause right here because that is so good to know, especially in BIPOC communities, Black, Indigenous, people of color. We have competing priorities, our children, our jobs. And so this is great that at Martin Luther King Jr. Hospital, they've taken away the financial barriers. So, it's free. And then B, it's open on a Saturday.
It's
So you can, come and just get yourselves, checked out. So I love that, Dr. Moradi. I love that. Thank
And they
you.
can also bring their children. And we have patients we always say, bring your kids. Don't worry. We will have a place they can sit and just do coloring and read books while you're getting
Wow.
your pap smear done. Yes,
That's amazing. So that's something that we call in public health. It's about the social determinants of health as we work our way towards health equity. So making sure that with our providers, we're looking at the patients and their needs, and we've thought about every single aspect, even down to, you're bringing your child here, that's okay. They can sit and color while you're getting yourself healthy, right? So I
correct.
love it. I love it. I love it.
Yes.
Okay. Marisol story.
Okay, so this is we usually have stories about patients who are happy that they were able to get tested so early, because cervical cancer, when you get tested early and you go straight to treatment, you get great result. I mean, cervical cancer, basically nobody should ever die from cervical cancer because it's so
Right.
easy to treat and it's so easy to find. So that's basically what we always say to the patient. Do not be afraid of cervical cancer. If you treat it early, it's a very easy cancer to treat. So this is a patient who had abnormal pap smear. She ended up with cervical biopsy and found out that she had cervical cancer, but she's happy that she was able to treat. And another story, patients who have normal pap smear, they just have to make sure that they get screened on time, like in another 3 years. The only problem with screening is that you're not supposed to just do it once. Screening
Right.
means you have to come back in 3 years and do another screening, or every 5 years and do another screening. You can't just say, oh, 10 years ago I had a pap smear and it was normal, so I should be fine.
Absolutely. It's just like getting that blood pressure under control, right? Getting your sugar looked at, right? Having a physical exam. It's a lifestyle. It's something that should be incorporated into our lifestyle, right? I love it. I
Exactly.
love it. And then your
Yes.
final
So
words?
make a promise to yourself and to your family that you will stay on top of your pap smear. You will do it every few years. And it's easy. Like I said, it doesn't cost anything. And you can bring your kids in, or they should not be any problem, basically, to get a pap smear done.
Absolutely. Thank you so much. And I do want us to continue the conversation just about, cervical cancer, because this was great. So let's give Dr. Maradia a round of applause for that
Thanks.
great presentation. And I just want to just go back to some things. So you said something that pricked my ears, and that was with HPV, you can get it if you're sexually active. And you said, oh, yeah, thinking about our youngsters and how they're exposed to sex. It's something that's prevalent in our society, especially with social media. What can you say to parents who are a little just, like, I don't want to get my 10-year-old vaccinated for HPV. That's my baby. What would you say to that
Yeah.
parent?
So I usually how I explain to them is that it the kids if they get vaccinated they don't become promiscuous. They won't start to have sex. It has nothing to do. It just prevents them when they will get married, when they will start their own family. So they will not be they will be able to fight against the HPV virus. So that's how I usually explain to them. And I just let them know that we have seen amazing results. The cervical cancer has decreased so much, like 80%. And abnormal pap smear, having to do biopsy, colposcopy have decreased a lot. I personally have seen a huge difference after patients getting the HPV vaccine.
Excellent. And then you also stated, just to go back, because that was another thing that pricked my ears. You talked about the racial disparities with African American or Black women versus non-Black women who are diagnosed with cervical cancers. And then it seems like when we're diagnosed, the prognosis isn't too good. Can you just tell me why? Is it because of medical mistrust, or is it just structural racism where things are just set up to where we can't be screened? Talk to me a little bit about that.
Yes, I believe it's one lack of insurance. So some of, unfortunately, our Black population and Hispanic do not have medical insurance. So that's one of the reason that they don't come for Pap smear. The other one is that they, like you said, they are so involved with their kids and they put them first. So they don't come and take care of themselves. It's always the family and the kids who come first. And once they got diagnosed, also there is a problem of follow-up. Would they come for their colposcopy, for their biopsy? And all those are kind of barrier who will, and usually they do work. They don't have time to come. Um, and when the clinic is open, they usually work long hours. So all of those added ends up giving us this issue.
Yeah, yeah, that disparity. So you said something that there's a lack of follow-up. So with your clinic, what is it that you all are doing to educate Black and Brown women about the importance of prevention of cervical cancer?
So when they come for pap smear, whenever they come to our clinic, we make sure they have an up-to-date pap smear. And then once we do the pap smear, we make sure they do have a phone number, a reliable number, so we can call them to let them know first that probably the pap smear is normal or if it's abnormal. And I think since COVID, we start to do a lot of phone visit, and that has really helped patients because they don't have to actually come to our clinic. So what we do, we call them. If we can't reach them, we keep calling them until we make sure have we're able to let them know that they need to come back to us for follow-up. So that is also huge, and we do have one person in our clinic who's responsible to follow up with abnormal pap smears.
Yeah, because what you mentioned, just with having a working phone number, and then also with telehealth, there's a digital divide. So, working in Washington, D.C., we saw that with a community called Ward 8. And it's similar to the community of Watts, where the health outcomes, they're pretty negative, right? And part of that is due to our digital divide, where you have people who don't have access to good Wi-Fi, right? So it freeze. Right. So,
Right, exactly.
yeah, so with your clinic, can you just talk a little bit about maybe what you guys are doing? Because you talked about the telephone calls, but anything with the digital divide with telehealth and getting follow-ups with the screenings?
So we do have a portal that we try to teach all our patients how to use it. So through their portal, they can see their lab results, they can message providers, and we answer them back. So every day we look at our messages to make sure that if they have any question, we can. So the portal is actually a chit chat between the providers and any questions the patient may have. Yeah, so this is what we use mostly, and patients are very comfortable in sending email and sending questions. But unfortunately, sometimes the phone, talking back about the phone, they change a lot of phone numbers. They don't pay on time. They have to get a new one. So we also send letters to their home if we can't reach
Yeah.
them.
Sounds like we need an app, right? An app for that. You know, the saying, well, there's an app for that. We need an app for that, just following up with patients regarding their screenings, because just getting the information, as we say in our community, when you know better, you do better. So I think that's something that maybe our public health students could work on at Charles R. Drew University of Medicine and Science, or even our community college partners. But I wanted to ask you something else. And you said the causes of cervical cancer. You said smoking, not just cigarettes, because we all know smoking cigarettes, it causes cancer, right? But you said smoking marijuana. Wait, come on, Dr.
Yes.
Moradi. Marijuana weed comes from the earth. How can that cause cervical cancer? Come on, drop some knowledge on us.
Not only cervical cancer, but actually decreased immunity overall. So any kind of increase, any kind of cancer, it changes the DNA, the methylate. It changed the DNA formation, so the cells do not have the power to fight back cancer. So not only cervical lung cancer, but overall cancer risk increase. Yes. So
Wow.
anything that comes from nature doesn't mean that it's safe.
Wow. Let's say that louder for the people in the back. She said, just because it comes from nature doesn't mean that it's safe. So yeah, we really have to rethink and look at what we're doing to soothe and heal our bodies. Sometimes it could cause, an adverse reaction such as cervical cancer. So thank you for that. I want to also turn to, it's the new year, and people have said yes, it's a new year, new me, new you. What part does diet play in cervical cancer, either the prevention or even the risk factors? I like sugar. I've done really well at bringing down my sugar intake, but talk to us a little bit how diet impacts the risk of cervical cancer.
Um, Cervical cancer is not really related to diet. Of course, we have to watch our diet for other reasons. But uterine cancer, if you have a very high BMI, increases the risk of uterine cancer, but not really the cervical cancer.
That's
So
good to know. That's good to know. Wow. Okay. Okay. So I am looking to see if we have any questions from our audience. And it looks like, let's see here. Okay. It looks like I'm not getting any, but that's okay because I have some more questions for you.
okay.
I have some more. So you stated that your clinic is at Martin Luther King Jr. Hospital. Can you just talk to us about what kind of hospital MLK is?
So basically, actually, our clinic is MLK Outpatient Clinic, which is attached to the hospital. So we are the clinic and not the hospital. and
Okay.
we are across from CDU campus. So we have our clinic has all different kinds from family medicine to ophthalmology, ENT, OBGYN, urgent care. So our clinic it has all the specialty basically.
I love it. I love it. And the fact that, like you said, just getting rid of those financial barriers and so forth. I really like that. I want to go back though and revisit what you stated about HPV and maybe the number of sexual partners that a person, be a male, female, can have. So to prevent HPV, how do we prevent it? How do we prevent the spread?
So the main one is to get vaccinated, of course. That's the best way to prevent HPV, and also to try to stay with the same partner, basically to have a monogamous um, sexual partner. Uh, those are the two main um, way to decrease HPV virus infection.
Mm. Condom usage?
Condom also will help. Yeah.
Okay. 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 So that's good to hear. That's good to hear. So you guys in the audience, that's something to think about. Just with what we see that's trending, when people say that they're sexually free, we want to be careful and make sure that we're taking care of our health because that's very important. So I see a question here, and it is um, you talked about pap smears, but and people say that it does hurt. How can I convince the person in my life that it's worth it, even though it's just a little uncomfortable?
Yes. Actually, pap smear is not supposed to hurt. It may be a little bit uncomfortable, but it's definitely not supposed to hurt. So, um, also being able to let your provider know when you want to start the pap smear that you're kind of anxious, so you need more time, and you can ask your provider to explain what the steps are, and usually people are anxious doing a pap smear, but then at the end they would say, "Oh, it was fine. It didn't hurt."
Yeah, it
Yes,
doesn't hurt. It's just a little uncomfortable.
yes.
It's a tad bit uncomfortable, but it's worth it. So, Dr. Maradi, do you have any other words for us about cervical cancer? What is it that we should know? What kind of practices, lifestyle practices we should adopt to our lives?
So the main thing is when you're young, make sure you are vaccinated against HPV. Try to use condom if you're sexually active. Make sure you are with one partner at the same time. Don't start very early. That's the other thing. The earlier you start, the more risk of uh, being exposed to HPV and getting cervical cancer and being tested. So 21 is the age you need to start to be tested for pap smear. So start early and keep doing it every 3 years. And that would be the best way to prevent any kind of um, cancer, especially cervical cancer.
Yeah, and then you also said with cervical cancer, it's the most preventable, right? It's the most preventable, right?
Yes, actually, it's the most common cancer in women at this point, but it's the most preventable. So if you do your pap smear on time, it's easy to prevent.
Okay, okay, it's the most preventable. And then, oh, treatment. I, I forgot that. So how is it
So the
treated?
treatment, so if you have abnormal pap smear, usually the next step is to do a colposcopy, which is done again in the clinic, and we do biopsy, cervical biopsy, which is a little bit more involved. It's not a regular pap smear. And based on the cervical biopsy, the result of it, you may end up with a bigger biopsy, which is called cone biopsy or lip biopsy, and those basically remove the abnormal cells. But if you end up having more abnormal cells, or the cone and the lip is not enough, then you will end up with hysterectomy, removal of the whole uterus. And if the stage keeps getting more advanced, then there is radiation, sometimes chemoradiation combined.
Yeah,
So for each
that's
stage,
yeah.
there is different kind of treatment.
Yeah, that's what I was gonna ask. Like, when would a person have to get a hysterectomy? I know in the Black community, a lot of African American women, we get hysterectomies, and sometimes it isn't needed. So, when would it be appropriate for a woman to have a hysterectomy?
I mean, cervical cancer is it. I mean, depending on the stage, one of the treatment is hysterectomy, but usually in our African American women, we do hysterectomy because they have more fibroids. So that's different because they have abnormal bleeding that do not respond to medical therapy, and they have to do full fibroids. But yes, you're right. The um, the hysterectomy is pretty high in our population. Yes.
Yeah, yeah, and then with the chemo and the radiation, when would that be appropriate?
So the more, I mean, depending on the stage of the cervical cancer, we may end up doing chemoradiation um, with a hysterectomy. Yes. So that would make it a little bit more, a little bit too advanced, basically. Than just the regular screening. Yes. So just to take the anxiety out, is if you have an abnormal pap smear, it just doesn't mean you have cervical cancer. You just need to come for probably a cervical biopsy, probably depending on again what the degree of abnormal cells are. But usually the next step is to do a cervical biopsy.
Yeah, yeah, just so that I say no, just like what's the treatment, and it could be a hysterectomy or chemo and radiation. So that's good to know, depending on the stage of the cancer. So I think that's great. Thank you for sharing your wisdom, your expertise about this
You're
this
welcome.
issue, that's quite prevalent. It can be quite prevalent in Black and Brown communities. But it's good to know that we at Charles R. Drew University of Medicine and Science, we are doing great things and making great strides to make sure that this inequity, this disparity in cervical cancer is becoming annihilated, and that gap is closing. So, Dr. Moradi, on behalf of the Division of Student Affairs at CDU, I would like to thank you for coming into the Lion's Den with us. And for
Thank
our
you.
audience, oh, of course. And for our audience, on February 5th, we will have a great conversation about heart health and obesity. And on February 12th, we will have a conversation about intimate partner violence, and that's dealing with teenagers. So a lot of this goes hand in hand. So I encourage you to follow us on Instagram, Facebook, TikTok, so you can get more information about Charles R. Drew University of Medicine and Science. And as Dr. Moradi stated, she is an esteemed alum of CDU. So just a
Yes.
friendly reminder that we do have programs, undergraduate programs at Charles Drew, which includes the Bachelor's of Science in Biomedical Sciences, the Bachelor's of Science in Public Health, the Associate of Science in Radiologic Technology. We have a certificate in tomography and psychology. And then, of course, we have our college, the Mervyn M. Dimely College of Nursing, and then, of course, our College of Medicine. So I do encourage you to check us out at www.cdru.edu. So until next time, you guys have a powerful day. Dr. Moradi, stay with us, but have a powerful day, everyone. And thank you so much.
Bye.